it's Dr. Campano. So people have been asking me about exactly what's a bruise, how long should a bruise be there. You can get bruises from any kind of trauma, such as if you ran into a wall, or you have some kind of traumatic incident. If you have Botox or fillers, that's a needle under the skin, so you can have a little bleeding under the skin, and that can lead to a bruise. And how long should a bruise be there? So essentially, what is the bruise? That's basically blood is trapped under your skin. It starts off as red blood because it's oxygenated. So the oxygen is sitting on something called hemoglobin, which is in the blood. And as that's breaking down, it's going to go from red, which is in the first couple of days, and then it'll break down and it will be blue, purple, even black sometimes over the next, like, say, 5 to 7 days. And then if it's further broken down, day 10 to 14, say, that's about yellow to green. So when you look at a bruise, you can kind of estimate how long it's been there. And then people ask, well, can I get bruising from Botox? You can, because it's a needle under the skin. So you can see that there's a bunch of blood vessels all over the head and neck area. It's actually shocking we don't get more bruising when we do procedures. And then a filler, which is a larger needle, because you have to actually put the filler into the area, can lead to more bruising. And so sometimes people are surprised that when you have some cosmetic procedures done, that you can have swelling and bruising. Of course you can, because you're doing some kind of trauma to the skin to get this item underneath and into the skin. When it's Botox, it's into the muscle. So I can't frown, so it's smooth because there's Botox stopping those muscles from pulling my brows down in the middle. And then also same thing, like raising the forehead up. There's a little bit of motion because I like to look natural, but not too much, so it's smooth and glossy. But if I did hit a little vessel, inadvertently of course, then it can bruise. And then what can we do to mitigate a bruise, to make it better? You can put ice on it. If it's swollen, you can elevate the area. And then there's Arnica montana, which is a homeopathic treatment to help with bruising and swelling. All my facelift patients, I have them use Cynic, which is a homeopathic Arnica montana, and there's actually been studies that show that it decreases swelling and bruising. I can see in my liposuction patients, the patients who use the Cynic and patients who don't, how good that actually truly works. And so there's doctors who believe in it, some people don't, but I think just in my experience, I've been doing this for well over 20 years, it really makes a difference. And then people also ask me, well, what about with fillers? When I do surgery on a patient, they never ask me, would I bruise? They ask me, how long is that bruise gonna be? They don't even question it, but when people have fillers, they act surprised that they could develop a bruise. Of course you can. It's a needle injecting an implant. So when we're doing a filler, it's basically a surgical procedure. It should be done with precision, but it's basically taking a substance, it's usually hyaluronic acid, or it could be some other substance, and it's injected, and it's an actual implant that it goes into your tissue, and it breaks down over a certain amount of time. Some fillers break down after about 6 months, a year, sometimes even 2 years. So anything that we do that traumatizes your skin, be it needles, lasers, surgery, you can potentially get bruising. It's naturally something that can happen, and hopefully it doesn't happen too often, but if it does, it's okay. Now, the only thing we really need to make sure is if it's a hematoma. So hematoma is basically blood that collects and it's trapped under the skin. And if it's trapped under the skin, it can actually be under pressure, and then if it sits there for a longer time, it can turn into an infection. So it's important to what we call evacuate the hematoma. Sometimes you've heard of people putting a needle in and draining it out. Sometimes after surgery, we leave in drains because the body kind of likes to fill up that dead space with something, fluid, blood, what have you, and so we can drain it out that way. So in summary, bruising can happen anytime there's trauma to the body, to the skin. It can happen with any type of needle injection. It can happen with surgery, and it can last a few days, a week, 2 weeks, and then if it's longer, then you might want to check with your doctor, but kind of on average, it should be gone within about 2 to 3 weeks. But if it's a hematoma, if it's red, it's swollen, it's causing significant pain or pressure, then contact your doctor or your surgeon immediately, because it might need to be drained out.